Hey, Wojo here. Here's my 3-week post-op update. It's actually 3 weeks to the day today. And so on April 3rd, we went in and had my prostate removed at Mass General Brigham's, the Newton Wellsley campus. Dr. Feldman operates in both spots, same robot. So we opted to save the wife a trip into Boston. And so we got there, much easier to get in and out of Newton Wellsley, and registered. We probably waited a half hour. They brought us upstairs, got me right into bed, IV in, checked over, asked me 300 times my date of birth and name to make sure it was me and what procedure we were having. Got me all IVs in, all that, everything set up. Met the radiologist, the anesthesiologist. And obviously, Dr. Feldman came in and talked a little bit before the operation. Basically got us, I think we were supposed to operate at noon. I think I was getting rolled into the operating room at 12:30. And the anesthesiologist had me out so quick, I don't even realize what time it was. Woke up, what to me felt like 5 seconds later. And, pain wasn't horrible. It wasn't great, but it wasn't horrible. Had my own room, which is a benefit. I was very concerned that I was going to be, bunking with somebody, which you don't feel good already. Why you want to share a room with somebody? The staff at Mass General, once again, zero complaints, absolutely fantastic. The night nurse, Katie, was absolutely phenomenal. Very attentive, made sure I had everything I needed. At one point, the TV stopped working. She was even standing on a stool, a chair to try to get the TV working, which she did. I was having a very hard time sleeping that night. I took an oxy, and even that was really nothing. And then they were doing blood work on me at 5:30 in the morning. But everything went well. I woke up with a surgical drain. Dr. Feldman came in earlier in the morning. Then one of his staff came in to remove the surgical drain. That wasn't. It wasn't excruciating, but certainly wasn't enjoyable. You could feel that thing coming out. And then they made me do a lap around the floor and sent me home. I think I was heading downstairs 10:30 the next morning. Rode home. It's about an hour drive. The ride home hurt. You got 6 incisions in you, and you felt every one of them. Then the first few days, it was rough. The weekend was a lot of pain. They sent me home with, I think, 10 oxys, which with 5 milligrams, they really didn't do a whole lot. I ended up using them, one at night just to try to curb the pain is what we ended up using them for. And not the pain, but to try to just mellow me out to go to sleep. They do send you home with a catheter. I've never had one before, so that was an interesting experience. Not the most comfortable thing to have in you or carry around. The only benefit is it's probably the first time in a decade that I got a couple of nights sleep of 8 hours in a row without getting up to go to the bathroom. Where pre-op, I was every couple hours I'd be getting up to go to the bathroom. So we had the option either since COVID they started doing video calls to take the catheter out, and we could either do that or go into Newton Wellsley or Mass General in Boston to have them remove it. I opted for the video call. I'm like, look, it's going to hurt just as bad if I do it or if somebody else does it. Also, we have the advantage that our daughter's an RN, so she was on standby in case we needed her for anything to help out with that. So the catheter coming out, definitely much more comfortable. Still had a lot of pain getting up and moving around, but without the catheter, it was a big improvement. The downfall was trying to sleep at night. My bladder was going haywire. I was getting up, every hour, if not more frequently, to urinate. I'm a diabetic, so I do drink a lot of water. I might have been drinking more that first week than normal, but it was just constant, and I had a very constant urge to urinate all the time. So very uncomfortable getting through the first week. Every day got a little better, and today we're 3 weeks out and every day gets a little better. Obviously that first weekend, it was very painful. The gas pains were the worst part. And it's not a normal gas, you feel that it's not like in where it should be. And you've never been so happy to fire in all your life after you've gone through this. And, the big thing is they do fill you up full of gas for the surgery. So you got to get all that out. So the second week, it was just, you're wearing Depends either, pads or Depend diapers. Very little control over your urination. Every time you move, cough, laugh, anything, you can feel the leakage getting up out of a chair. And that's still, it's still there. We're today's the third week to the day. Still got the pad in or wearing Depend the underwear. Either way, it's like the same thing. But if you move, you twist, you definitely feel the leakage come out. Stream of urine is much better than pre-surgery. That's without a doubt. We're just trying to figure out why I'm urinating so much. I do know I drink a lot of water, and I've been trying to cut that back, but it's still pretty frequently. And during the day it's not so bad, but at night's horrible. We did go to lunch last Saturday, and I probably should have gone to the restroom one more time before we left the restaurant. But it was only a 10-minute ride. I'm like, no problem. I felt the urge to urinate before I got in the truck. Holding it for 10 minutes was some of the worst pain I had the entire surgery. So definitely not trying to set myself up for that again. So we're not going to be doing any longer car rides for probably another week before we try going any further than what we did. But other than that, every day gets a little bit better. I'm still on the Can't Lift More Than 10 or 15 Pounds program. That's supposed to go for 6 weeks post-op. I was informed, which kind of broke my heart. I was assuming I couldn't ride my motorcycle for 6 weeks. Dr. Feldman informed me it's going to be more like 3 months, or until I completely get my bladder control back. Doesn't want me straddling anything and bumping and screwing up the good work he did down there. Speaking of that, he did do an excellent job. He got all of the cancer out. Once again, we caught it very early. I was stage 2, Gleason's 7, I believe it's 3+4. And when Dr. Feldman came in the next day, he goes, best thing I can say is just everything went normal. There was no surprises. It was a routine surgery. And he said he was also able to really minimize any nerve damage when he was in there, which is huge as far as getting your bladder control and your erections back. So once again, he is one of the best, and that's why we went there. I had my follow-up a week ago tomorrow, and pathology came back, and Dr. Feldman did confirm that the cancer did not spread. So we're pretty much good to go. We don't need any additional treatments. He's going to take a PSA in 3 months to see if there's anything scary there. But like I said, he's not expecting to see anything, literally expecting to see 0 for a PSA level because there's no more prostate. But other than that, in happier news, yesterday morning, I woke up and I had half of an erection, I'll call it. But right now it's, happy to have any activity down there at all. And I'm sure it'll get better. He does have me on a low dose of Viagra every other day. So we'll just keep going with the course of plan. I'm probably planning on going back to work fairly soon now. My biggest holdup is I do have to drive for work a lot, and not being able to just trying to hold in going to the bathroom is just not enjoyable right now. So probably gonna give it another week. Hopefully not 2 weeks, but probably another week, and then we'll see how it goes. But we'll keep you guys updated. It's been a long process. But hey, it's better than the alternative. They got the cancer out, and we should be good to go. Might do 1 or 2 more updates as time goes on, as I progress. and let you guys know what to expect if you ever unfortunately have to go through this. It's nothing I'd ever want anyone to sign up for, but I have friends going through much worse things than this right now. So if you got to get the big C, this is probably the one to get. Anyhow, we'll keep you updated, and we'll talk to you later on.